Jessica Fritz, who's going to talk to us about mental health ecosystems. And Jessica's from the University of Cambridge. So if you'd like to share your slides, Jessica, then...
Yes, thank you very much.
Thank you.
It says screen sharing is disabled, but I'm going to try again.
You might need to click in PowerPoint for it to activate.
Okay, I think it's working now. Can you see this?
Yes, we can. Thank you.
Perfect. That's great. Thank you very much for having me. So I would like to talk about a student project we have run at our university, and we call it the STEP study. So why did we look at student mental health during the COVID pandemic? So I think in general, student mental health is an important issue for various reasons. So one reason is that we know from the developmental literature that a lot of disorders develop during adolescence or young adulthood. Some disorders develop earlier, such as anxiety, some develop a bit later, such as depression, but a lot really start to develop during these young adulthood years. And what we also know from epidemiological studies is that at least 1 in 5 students report to suffer from mental health problems. And then again, we can think about anxiety and mood, but also about, for example, suicidality. And some studies, and frankly speaking, that has not always been replicated, but a lot of studies so far have shown that this seems to be the case, is that students have more mental health problems than same-aged peers. So before the pandemic, there was also some studies looking into risk factors, and there were already some risk factors identified, such as academic pressure or concerns about professional development, financial worry. And now during the pandemic, there are obviously a lot of more factors that may put students at risk. So when we look at the pandemic literature, there are a lot of factors that relate to lockdowns, such as uncertainties about the course of the study program and changes in the teaching format, reduced study time. Some students report conflicts in their households or with neighbors or noisy households, and a lack of green spaces. And all those factors have been reported to put students at a higher risk. And then obviously we all know that the quality of COVID studies varies a lot, but I think there's quite some growing evidence that there is, that there are risk factors in the student population that are specific to the student population, and then that may explain why students are at an increased risk. So, okay, yeah, now it works. So other factors relate to social isolation. We can all imagine that difficulties with isolating or feeling lonely, lacking social support are factors that may contribute to mental health problems. And those are obviously also for many people amplified now during COVID, and particularly when we were in lockdown in the UK. And we were quite long in lockdown. We were in lockdown, I think, until early May, and then there were some loosenings happening over time. And then, of course, there are disrupted or delayed opportunities, such as postponement of final examinations, and also COVID-related financial stress. So I think in sum, what we can conclude is that maybe even though not all the COVID studies are of equal quality, and some are probably not as good as we would want them to be. But I think the conclusion generally from the literature so far is that there are a lot of additional risk factors, and that this may be one explanation for why we have seen in the media, but also in some studies, that students are at a particularly high risk and a vulnerable population during COVID times, and that a lot of students report mental health problems. So we also had such reports at our university. And we set up this study. We set it up really quickly, and there are a lot of limitations to the study, but we set it really up to find out what increases poor mental health among students, also what factors foster good mental health among students, really to get some starting points to think along the way of how we maybe in the future can better help students now during these uncertain times. And also students obviously are now coming back to university, so times are changing again. So we thought it would be good to get a better understanding of the population and maybe get some first hints of how we can help them along the way. So that was obviously very broad. And I cannot answer all of those questions, and definitely our study can also not give all the answers. But we have set out some more specific research aims, and the aims I will discuss today focus on a daily battery of questions that we have assessed among the students. So the first question we put forward for this part of the research project is the question how psychosocial factors and mental health affect each other. And why is this relevant? So this basically has the idea that we can find out which factors have a particularly positive or negative effect on student mental health. And then we looked over the course of the study, so more in general, and we looked also on day-to-day effects. The second question I briefly want to discuss is which COVID-specific factors have an effect on student mental health. And why is this relevant? This may be relevant because there's COVID-specific factors. Well, I think actually it may be relevant because we do not know a lot about that. So we really wanted to try to figure out which factors may put students at risk. And then if I say COVID-specific factors, I will later on say a bit more about what we've exactly measured, but you can think about something like COVID anxiety, which is something that really only now developed during the COVID pandemic and wasn't there beforehand. And then the last research question I want to shed very briefly light on is that we also try to explore how our what we call mental health ecosystem relates to a more traditionally measured Transdiagnostic distress index. Okay, so briefly about the study, there was quite a bit that we've measured. We had a huge base. Well, we had quite some questions in a baseline survey that were about demographics, but also about contextual factors. And then the main part of the study was really this ecological momentary assessment battery, which were 10 items, and we assessed them every day. We tried to assess them at the end of the day so that students could reflect on the day. So it was a daily retrospective measure, basically. And then we had also a weekly measure, a weekly Transdiagnostic mental distress battery. And this battery was based on earlier studies that had been conducted in our department, and that was a collection of 122 items covering mood symptoms and anxiety symptoms, but also OCD and behavioral symptoms, for example. So we didn't assess all of those items in all students, but we had some clever algorithm, a computerized adaptive testing algorithm that tried to select the most important items for specific students to get an accurate estimate of where the student lies on a distress continuum. So on average, students had about 5 to 15 items they answered every week. So it was very brief, much briefer than we had thought initially. Right, and then we had an exit survey where we again assessed demographics and contextual and physical health data. Okay, so I'm briefly going to tell you a little bit more about these 10 EMA items, ecological momentary assessment items, because those are the ones I will be talking about.
I think we might have just lost Jessica there. Just give her 1 minute. Hopefully her sound will come back on. Jessica, come.
Can you hear me?
Lovely, can hear you again.
Yes, oh, perfect, thank you. I'm so sorry, I'm in the midst of moving house and my internet is terrible, which is also why I had my camera off and why I was thrown out yesterday like 4 times. I'm so sorry. Okay, I will continue while it's going well. So we assessed a mental health item, which obviously is a bit bold because you may wonder what actually can you assess with one item and what may it reflect. But we had to constrain our battery quite a bit because we tried to balance the student burden and with what we can find out with our assessment. So we really tried with the first wave of this study to have a brief assessment battery because we didn't want to put the students at more stress. we didn't want to cause more stress for them. So we had one mental health item, 5 psychosocial factors, which measured the ability to relax and enjoy, workload mastery, loneliness, social support, and uni support. And we had 4 COVID-specific factors, and those were, so the first one was more what we thought a protective factor, being content with others adhere to COVID guidelines. And then the next 3 were more risk factors. So the first one was COVID anxiety, the second one was self-isolation worry, and the last one was being worried about causing others to isolate. So to give you a brief overview of the sample, 2005 students of the entire student body consented. We had to remove some because they withdrew from their studies or from the STEP study. We also had to remove some because they have had invalid timestamps. And then we had to remove a lot of students actually because they submitted less than 30% of the EMA battery. So we retained 861 students for whom we could retrieve reliable estimates. I'm briefly trying to summarize what the sample looks like. So in general, the sample is not representative at all for the general population. It may in some regard be representative for the Cambridge student population, but in some regards also not. For example, we have oversampled females, 70% were female. Students were overall rather young, but that is in some sense representative for the student population. We also had some older students, which made us quite happy. We had a lot of UK students, or a lot of students with UK nationality, 70%, and students who participated predominantly lived in the UK during the lockdown, but not necessarily in Cambridge. Yes, and maybe to say one positive thing about our sample, which I personally was very happy about, is that the students who took part, or actually the students which we analyzed, was spread across 211 different study subjects and across 76 departments. So that was nice, that in that sense we actually had quite some diversity in the sample. And the last thing to say about the sample is that although the analysis sample is much smaller than the actual consenting sample, there are actually only quite a few differences between the analysis and the consenting sample. So in that sense, we were also lucky. Okay. So what we did over the course of the study as well is that we every week we obviously try to monitor the mental health levels of the students. And we used this computerized assessment testing battery, which was originally developed in a young people sample of about 2,000 young people. And there it was scaled and had a mean of 0. And then in our Cambridge University student sample during the pandemic, the mean was in the first week as high as 1. And then over the time of the study, it very slightly decreased, but it was still much higher than in the young people sample. So that does not necessarily mean that the COVID pandemic has caused all of the mental health problems. It may also just be that our student sample is in general more stressed than other young people. So it may just be a sample difference, but I think what it shows in general is that the sample we are looking at, that there is quite a high level of mental distress. So I think it is worth this sample and to try to find out what factors maybe help to foster better mental health. So I will keep the introduction to the analytic approach very brief. It's not very important to understand the findings. I will just say 2 things. So in the modeling procedure, we have basically looked at 2 models. One was a stationary model in which we looked at how factors relate to each other over the course of the study. So you can, for example, think about the question, how is social support over the course of the study associated with mental health? And then we looked at a temporal model. And what we did there is we looked at day-to-day effects. So what we tried to find out there is how social support today affects mental health tomorrow. So there we have a day-to-day effect really that we see in the model. And then the third type of model we are looking at is a moderation model. And what we try to find out with this one is to see whether the COVID factors amplify the relationship between psychosocial factors and mental health. Okay. Right, so finally to the findings. So this is the very first model that came out of our study. And then I would like to say, first of all, I should have said this earlier. So this study is really very exploratory, and it's also a bit of an ongoing study. So there's a lot more data that I won't be talking about because we haven't analyzed it yet. So I will just give you really the overview of the things we have seen so far. So this is the stationary over the course model. And what we see there is a lot of things that we would have expected, that students who have in general a higher ability to relax and enjoy, who have a better workload mastery and have more social support, also have on average a higher level of mental health. We see the opposite for loneliness, which makes sense. And then university support wasn't directly related to mental health, but had seemingly an effect via social support. So if we now look at the exact same factors, but look at the temporal day-to-day network, then we see again a similar pattern. So we see that being able to relax and enjoy, having a good workload mastery, and receiving support from the university today has a positive effect on mental health tomorrow. We see again that loneliness has a negative relationship with mental health. So if I'm more lonely today, I have a worse mental health tomorrow, or I have a lower level of mental health tomorrow. And what we see here is that social support does not have a direct relationship with mental health anymore. Here, the effect of social support seem to go via loneliness. So it suggests that social support today dampens loneliness tomorrow. So what is a bit interesting is that the university support has an effect on the day-to-day level, but not over the course of the study, while we see the opposite pattern for social support, having no effect on a day-to-day level, but having an effect over the course of the study. So we very briefly zoomed in the social support link to explore this a bit more, and therefore to that end we looked at the residual network. And that's a temporal network. So this network shows us whether there's a temporal effect of between social support and mental health, which is there, but just doesn't operate on a day-to-day time scale. So that means that the link between social support and mental health either operates on a scale quicker than from day to day or on a slower time scale. So for future research studies, we may keep in mind that not all the variables we are looking at necessarily operate from day to day, but some may have a quicker, slower relationship. But then to the next bit of the study, and this was interesting, we thought, was how the COVID-specific factors relate to this ecosystem. So being content with how others adhere to COVID guidelines was not at all related to the system, neither on a daily level, nor over the course of the study. And COVID anxiety was related to the ecosystem. So if you the students who generally experience higher level of COVID anxiety have in general a lower ability to relax and enjoy. They have a higher level of loneliness, and they either have or need more university support. So we thought this was really sensible. We saw something similar for self-isolation worry. Students who have a high level of self-isolation worry also are more lonely and have a lower level of mental health. And we see the exact same pattern for being worried of causing others to isolate. So if students are very worried about that, they are also in general or on average more lonely and have a lower level of mental health. Okay. So then we additionally try to find out whether there are some more complex interrelations in the network, which we have in our more simple networks missed out on. So we checked for moderation effects. Particularly, we checked whether the COVID factors modify the relationships between psychosocial factors and mental health. And among all those relationships, we could only identify one moderation effect, which was that being worried to cause others to isolate amplified the relationship between social support and mental health. So you may wonder why. And we thought it could, for example, be that for students for whom the support system has a very positive effect on mental health, so seems to be an important factor, that they either seek out more support and therefore are more often worried, or that they are just in general more worried about their support system because it's such an important factor for them. But it is, to be frank, just one moderation effect among a lot of potential moderation effects. So in general, I would say what we see here is that we see a lot of direct and indirect connections, but not necessarily so many more complex amplification effects. Okay. So that was the last research question, and I will very briefly give you a summary of the findings. So here we did something even more exploratory than in the other two research questions. What we did here is we replaced our mental health item, and that is item 1 in the models. We replaced that with our transdiagnostic mental distress index. So what we would have expected is that the relationship between mental health and the psychosocial factors is in the exact opposite direction as mental distress and the psychosocial factors. And this is also what we have seen, or what we see in the findings. What is interesting, though, is that not all the relationships seem to be exactly opposite. For example, if we look at the COVID-specific factors, and those are number 4, then we see that in the mental health ecosystem, only self-isolation very relates directly to mental health, while in the mental distress networks, all the COVID-specific factors relate directly to mental distress. And the other thing that we see, and I'm
conclude, please, Jessica. Thank you.
Sorry, can you?
Could I ask you to conclude, please?
Yes.
Thank you.
I'm just going to go to the next slide. So this slide. So what may those last findings suggest? I think, well, we are not quite sure. It could either suggest that the mental health item lacked granularity and may not be as precise as the mental distress index. It could also be the other way around, that the mental distress index lacked granularity because it was only assessed once a week and not every day. Or it may simply mean that the mental health item and the mental distress index really are not opposing sides of the same coin, but are more orthogonal, for example. But the mental health items roughly seem to have measured what it was intended to, and this definitely needs a lot more exploration, particularly also on the day-to-day level. So I think I've written up a few implications that can come out of the study, but I think they were more or less clear in discussing the results. So the COVID-specific factors, particularly anxiety, self-isolation, worry, and being worried to cause others to isolate, are in general associated.
Sorry, Jessica, we're going to have to stop you there, so we've got time for everyone else to speak.
No,
okay?
that's fine. Yeah, I'm sorry.
Yeah, fine. Okay.